It's just awkward. Pause. All right. Well, everybody is joining us. I will go ahead and get started. Welcome everyone to the Breast Cancer Coalition's evening webinar series. We have a really exciting panel tonight, and we've had some questions come in ahead of time for the panelists, and just a lot of discussion too in the walls of the coalition about what we're going to learn tonight. As I get started, I do have an ASL interpreter for this evening, and if there's any issues with being able to see them when we're presenting, please type it in the chat. I'm happy to help out with that in the background. But I'm going to let our executive director, Holly Anderson, start us off with a little bit of background that led into this evening's seminar. Take it away, Holly.
Hi there. Yeah, I wanted to lay the foundation for why we're even here talking tonight. It gives me an opportunity to also reconnect with Dr. Luke Papone, who was very instrumental in ensuring that we're here tonight. The Breast Cancer Coalition dug into this issue with the New York State Senate. If you're familiar with politics at all, in the Assembly, they were trying to get medical marijuana passed, and it languished for 17 years. They could not get it to the Senate floor for a vote. And we just decided in the summer of 2014 that we were going to tackle this issue. It wasn't that that we think that there are miracles with marijuana or cannabis. It was that we were frustrated that we did know anecdotally people who were using it, whose suffering was alleviated or reduced, and that we could not, our researchers could not really properly study this plant. It's a botanical that has over 500 compounds. It was illogical to us that we couldn't take a look at these like other botanicals. And so we actually engaged Dr. Papone to help us with our Senate members to educate them on what we knew and what we didn't know. We started this the summer of 2014. We were told by the governor's office that it would be a 5-year fight, but we also had patients that didn't have 5 years. We went to Albany almost weekly with our wonderful advocacy committee members. We engaged other folks that were dealing with other diseases. Multiple sclerosis patients went with us, nurse practitioners. We took them with us. Parents of children with intractable seizure disorders we took with us. And this miracle of miracles, we were able to get it passed about a year later. It was signed into law in July of 2015 and implemented, I think, January of 2016. But it was not an easy experience. We could not have done it without our scientific community, who were so helpful in assuring our elected officials that this was not going to be a slippery slope. We're grateful. It's wonderful to see Patty Malabar, to meet you. We've heard nothing but wonderful things about you. We know Stacy Ferret. She is absolutely a phenomenal pharmacist and is able to answer a lot of questions that we get. We're just grateful to everybody to be here tonight. We haven't really gathered. I think the last time we gathered in a big way was at Monroe Community College when we hosted a public forum. Dr. Papone was on that panel. Several of our senators were on that panel. And do you even remember that, Luke? It was packed, and people just really wanting to understand the properties, how they could possibly help cancer patients. And that's where we are tonight, to sort of catch up. A lot of times we hear from patients, from clients that we serve, why can't I just buy it at the head shop? Why do I need a prescription? Why do I, what's the difference between in quality between what's over across the parking lot or whatever. This is what we're doing here tonight, to sort of learn more about these properties, where we are with research, and where we go from here. So thank you all for joining us. And if you care about these issues, please consider joining our advocacy committee, because we definitely get stuff done.
Thank you,
Thank
Holly.
you.
This is true. We like to get stuff done. I'm going to slip you right over to participant here. And all right, so welcome everybody. Before we get started, just a couple things. Please feel free to put any questions you have in the chat during tonight's presentations. We will have a facilitated Q&A session afterwards. I did get a couple questions in advance. Thanks very much. We are very excited about our upcoming Pink and Teal Challenge. It's our 5K run and walk on Saturday, May 13th. It's at Monroe Community College. You can visit our website, bccr.org, to register. At any point that you leave the webinar tonight, you will see a survey from Zoom pop right up on your browser. Please take a few minutes. There's just a few questions, and we really use all of the feedback in the upcoming presentations that we use. So we really appreciate the time that you spend with that. So just getting ready here tonight, I want to thank you all for joining us on this panel discussion regarding updates in medical cannabis, looking through 3 different lenses: the researcher, the prescriber, and the pharmacist. I can't wait to hear a lot more about them, but here's a little bit of background. So Dr. Luke Papone joined the faculty of the U of R in 2007 as a research assistant professor. He earned his doctoral degree in epidemiology and community from social and preventative medicine at SUNY Buffalo. His research focuses on using nutritional supplementation and exercise to treat the symptoms and side effects of cancer and its related treatment, including cancer treatment-induced bone loss, arthralgias, fatigue, cognitive difficulties, and sleep problems. He's very, as Holly mentioned, he's very involved with the cancer advocacy community and has given numerous local and national presentations on a variety of cancer-related topics. We've got Patty Malabar, who joins our panel as a nurse practitioner and program director of the Wilmot Nicotine Dependence Program. Patty completed a doctorate degree in nursing practice from the U of R School of Nursing in 2022. And Stacy Ferret tonight is with us as a pharmacist with Columbia Care Rochester Dispensary and a graduate of the Breast Cancer Coalition Emerging Leaders Program in 2022. Since 2012, Columbia Care has built a cannabis company rooted in quality, expertise, and trust. As one of the original medical cannabis operators, they focus not only on patients and customers, but also to be in the involvement in shaping the industry alongside the cannabis community as a whole. So the plan for this evening, I'd love to start off with Dr. Papone. We'll next move into Patty Malabar and then go over to Stacy. Each have a set of slides that were shared in the Zoom link reminder that went out, and it's also available on our website. Allie was just going to put the link right there if you wanted to access those ahead of time. And I will be in the background with any tech help that I can offer, but Dr. Papone, please take it away.
Thank you very much for that great introduction. Good evening, everyone. Hopefully everyone can hear me all right. And I just want to present just a few slides, not too much, but just go over where things are at and use those for a point of discussion later on. So I'm going to start my slides up. Sure. So again, we're talking about the updates in the medical use of cannabis. And I believe it was 2014 we signed this into law. I'm not sure if Holly said 2016, but I think it's 2014. I'll have to look that up. That we enacted medical marijuana in the state. Any residents are being treated here, and you had to have a qualifying condition, you could receive 30 days. So here's the initial qualifying conditions. You had to have a disease and usually a symptom, and it was pretty strict in the beginning. And now I would say it's loosened up. I believe that I checked the website today, and I'm pretty sure that there's actually not technical qualifying conditions. It's almost left up to the prescribing uh, physician or doctor or nurse that's prescribing. But I'll check with Dr. Malabar on that. So as you can see, it's a pretty serious list, but as time has went on, it's sort of opened up quite a bit in terms of diseases and symptoms. But that was the original ones, and there's been a few more added over time. There's been a recent expansion of available products, and Stacy can talk about this a little bit more, but there's tons and tons of products. You have vape cartridge in the vape pen. You have capsules. You have tinctures, which are put inside your lip and your gum, oral sprays, oral powders, lozenges, metered plants amounts for vaporization, whole flower cannabis for vaporization, transdermal patches, and in New York State, you're even allowed seeds for home cultivation. New York State actually has a quite handy home cultivation guide for any folks that are interested. And I came across that today. And it's a nice little 17-page PDF that's fairly useful if you wanted to grow your stuff at home. So what is the state of cannabis research? Unfortunately, it's still poor. There's been a significant lack of research, and that significantly, we talk about clinical trials in that context. There's hardly any clinical trials. And that is because there is a divide between state and federal, whereas we're talking about the state law here tonight, which gives patients access to medical marijuana. It unfortunately doesn't come over to the clinical trial side, which is under the federal purview. And that unfortunately has hindered my job greatly. To make this story, long story short, it seems that those wrongs are being righted now, and the government, specifically the National Cancer Institute and National Institutes of Health, are making large grants available right now. They just asked me to be on a grant review panel for non-clinical trials, and I got my fingers crossed that they're going to be releasing calls for grants for clinical trials in the very near future. However, it's still going to be 2 to 3 years for this. Essentially, the reason is the source. When you're conducting a clinical trial, you have to get any substance like marijuana from the federal government, and they wouldn't allow us to get it from states. And the federal government supply, up until recently, wasn't really grown for human consumption. So it's only recently that we'll be able to get these trials underway, and it seems like things will finally start happening. So in light of that, the little evidence we have and the few trials here in some other countries, I can tell you some of the best evidence in the current recommendations. Some of the best evidence we have is for cannabis, is specifically for nausea and vomiting, more specifically nausea, because the drugs we use in cancer patients are very effective at controlling vomiting. However, they're not quite as effective at controlling nausea. And adding cannabis to that usually provides significant nausea relief. Appetite, cachexia, which is wasting. There's really no drugs, no pharmaceuticals on the market to stimulate appetite. There's steroids and things like that, which have side effects and such. And sometimes we can use that to stimulate appetite. But cannabis is honestly one of the best appetite stimulants we know of. And there's good evidence that cannabis provides good sleep, especially when someone suffers from night terrors or PTSD. Cannabis is very effective at dealing with that. We have moderate evidence for pain, both general pain and nerve pain. And there's some evidence for anxiety and depression. Really make no mistake about it, cannabis is very good for anxiety acutely. However, it only works when you're on it. It's not one of those that you can be on all day and it relieves your anxiety. So, that's how I would put that in the moderate evidence. So, despite the lack of evidence, there are a number of issues that cancer patients deal with that cannabis, we believe, can be helpful for, and hopefully can add more evidence. So I just want to talk maybe on some of the recommended uses. There's so many products out there. And again, we'll cover all this. I mean, it's sort of crazy, all the things out there to keep up with. But some of the most, I mentioned a whole bunch of them before, but some of the most popular ones are the vape cartridge or the vape pen, and then oral or edible, gummies, or, not, I don't know it's allowed to be sold in New York State, but I know that many patients illicitly get gummies, brownies, cookies, such as that. And I know that the dispensaries also sell oral pills, which are very similar. And then you have actual cannabis flower that you can put in a vaporizer. So from a research perspective and treating your symptoms most effectively, I would probably caution against using the vape cartridge and the pen and lean more towards the oral and the edible, just because those have most of what the whole flower has and often be the most effective. The vape cartridge and pen is very effective, but it's more effective for the recreational user. It's very discreet, but it's short acting. And patients often have to use it every 15, 30 minutes. So they find themselves using it quite often, where often an oral or an edible or the whole flower might be more appropriate. Just to show you some examples, like different side effects require different products. So we'll take nausea for an example. You wouldn't want to take an edible for nausea because first you have to eat something, which is not fun at all when you're nauseous. And using the oral edible route can take anywhere from 30 to 120 minutes for it to start working. So you want something fast acting, such as a whole flower vaporizer, which can be turned on and used within 2 minutes and usually give relief within about 30 seconds of that. So if some patient came to me with nausea, you would say, oh, you might want to try this type of flower vaporization. As where sleep, you might want to try something oral or edible because it's longer acting and tends to induce more of a sleepiness effect than, say, vaporizing generally. So these are some of the things you have to keep in context. These are some of the things we're glad to talk about as we get in here. And I know the other two panelists are going to touch upon this as we go through. Just a couple fast facts. I remember I hadn't given this talk since like June 2018. At that point, there were 1,700 registered practitioners. I know Patty was one of them. And there were about 61,000 certified patients. I looked today, and we're at about double that. So it took about, a little under 5 years, we've doubled that. About 121,000 registered patients and just under 4,000 certifying practitioners. And that number is great. So it's definitely growing. And it's going to be very different when recreational use is a full go, as you guys are already seeing. So again, here's my contact information. And I'm going to hand it back over to our other panelists, but make sure you guys have my contact information. I'm going to be here and we're going to do question and answer in a little while. Thanks, guys.
All right, thanks so much. Lots of questions pouring into the chat, so we'll be going through those. Patty, I'd love to turn it over to you.
Thank you. All right, so I am coming at this from the lens of a prescriber. Just to give you a little bit of an idea, I started doing medical cannabis management with patients in probably 2016, or 17 maybe. When the program initially opened, only physicians were allowed to do it. And it has evolved since then. So now nurse practitioners and physician assistants can also do it. And we'll talk a little bit about who else can do it now, because that has also been updated. So tonight we're going to talk a little bit about who, what, when, where, why, and how. So we're going to do a little bit of everything. So we're going to start out with when. So as Dr. Papone mentioned, there are some competing kind of laws between federal and state, right? So New York State says that we can utilize medical cannabis under the auspices of the Medical Marijuana Taxation Act. And the federal government in 1970 decided that cannabis was going to be a controlled substance. So in 1970, the Federal Controlled Substances Act placed substances on the schedule in a manner under 5 different classifications. So basically I'm not going to go through all the details of what they did, but they looked at their potential for abuse, evidence of pharmacological effect, scope, duration, significant chance of abuse, that kind of thing. And they started classifying different kinds of substances. And cannabis or marijuana was classified as a Schedule I substance, which is the kind of top notch. And basically, I'll show you the schedule in a second, but it basically says that cannabis has no evidence of effectiveness and high evidence of abuse, or high potential for abuse. So that was 1970. So since the mid-90s, many states have enacted laws that allow and protect the use of cannabis medically and recreationally. Each state is a little different. There is some conflict, again, between the federal rules and the state rules, and that is always going to be an issue. There's been a lot of attempts to get the DEA to reconsider the classification, but so far no one's been successful. So this is what the schedule looks like, and I'm not going to go into the whole thing because it's very busy, and I apologize for the busy slide. But the top category, again, is no accepted medical use and high potential for abuse. That's their words, not mine. So cannabis is sitting there next to things like LSD, heroin, and certainly I don't believe it belongs there. The other interesting part of the schedule is that dronabinol and nabilone, which are medicines that are made of synthetic THC, which is very similar, identical to the THC that comes from the plant, are further down the schedule and not considered no accepted use. So just want to point that out because those are 2 prescription drugs that are available that are not always effective, but can be used for nausea and vomiting, especially in the cancer patients. So this is just a little map of who is legal and who is not legal. This is the most recent one I could find. And as we mentioned, July 8th of 2014, the Compassionate Care Act was signed and we became the 23rd state to legalize medical cannabis. Then in March 2021 was the passage of the Marijuana Regulation and Taxation Act, or the MRTA. And that was, we became the 15th state to legalize recreational cannabis for adult use. So now we are a dark green state. You can see there are plenty of dark green and light green states. A lot of, if we were to take a political map and put it up next to it, not to get all political on everybody, but there is a very red and blue theme to these states as well. So next we're going to talk about how. So what is the process of prescribing? So I'm actually not going to say that because that is not the correct term. What we're going to talk about is the process of certifying. So in some instances, we would write a prescription for things, but when it comes to medical cannabis, we actually don't prescribe it, we certify for it. So yes, it's a logistical kind of difference in legal terms and that kind of thing. But again, because this is a Schedule I drug, I cannot prescribe it. So I am very careful to try to use the language of certifying and not prescribing, but sometimes, you know, they crisscross a little bit. So again, cannot prescribe those Schedule I drugs. So here is kind of an early on graphic that the New York State program put out. And basically what I want to highlight is my responsibilities as a practitioner. So I had to go in educational programming, I had to register with the state of New York, and then I became able to certify patients. The patient's process, which we're going to talk a little bit more about the details of that, is that the patient would register online, get a medical cannabis card, and be able to go to the dispensary. These rules and regulations have been adjusted in the recent days, so we're going to talk about that in a couple of slides. We're going to go on now to who. So if someone wanted to be a patient in New York State, what would be the requirements for that? So you have to live here, You have to be treated here for your condition. You have to be certified by a registered New York clinician, and we'll talk about the clinician requirements in a few minutes. And then you need to register online with New York State. And there's a little asterisk there because literally days ago, this did change. So before, my patients would get certified prior to Monday, and they would get a medical cannabis certificate. They would register with New York State and get a medical cannabis card. And they would need both of those to go get their medication from the dispensary. Since Monday, so that was the previous kind of process. Since Monday, they actually changed the rules. So now when the certificate is printed, there's a barcode. And if you see, I put a little arrow kind of pointing out that barcode. That is now the cannabis card. So they're not making the medical cannabis cards anymore, and patients actually don't have to go register anymore. So they can actually just take this certificate and go right to the dispensary with a state or government issued ID. So it's really an amazing progress that we've made. And I can't tell you how many of my patients over the last 6-7 years have not been able to go forward in the program without help because they just cannot do this registration process. It's very cumbersome and problematic. So one of the big victories in the last few years that I've been involved with the program for sure. So a couple of more patients, the patient details. Once the patient's registered or certified after Monday, they can go to they purchase their medicine from a New York State approved medical dispensary. They pay cash for medicine. It's not covered by insurance. And they can also designate up to 5 people to be caregivers for them. And caregivers are people they know and trust that can go pick up their medicine on their behalf if they're not able to or don't want to. Can purchase up to 60 days of medicine. And if you remember, Dr. Papone mentioned in the beginning, you could only get 30 days of supply. So that has gotten better. And can grow their own plants at home, which has been effective since October. And again, Dr. Papone mentioned this one. As of March 1st, there were over 121,000 patients registered in the program. So to be a clinician in the program, this has changed as well. So again, like I mentioned in the very beginning, only physicians could do it. Now, actually, all you have to be is a licensed clinician who is registered or certified by New York State to prescribe a controlled substance. So this would be doctors, dentists, podiatrists, physicians, nurse practitioners, PAs. That isn't going to change. And you also have to have a valid DEA number, which is a national number that we have to kind of apply and pay for. We have to be qualified to treat the conditions that we're certifying the patient for. So the conditions we're going to talk about in a couple of slides, but I only am allowed to certify patients for what I treat in my practice of oncology. So I really treat patients with cancer-related symptoms. And if a patient comes to me and says they have Parkinson's or they have seizures or they have irritable bowel syndrome and they feel like they would be a good candidate for medical cannabis, I cannot certify them because I do not treat those conditions. I had to complete a 4-hour class. Now it's 2 hours from what I hear. So there's options you can choose from. It does cost a little bit of money to do the class online, anywhere from $165 to $229. But we also can get continuing education credits for it, which is a bonus when you need those. And then you have to register with the New York State Medical Cannabis Data Management System, which I did do back in the beginning. You can be listed online. I am not, because I am dedicated to treat the patients at Wilmot Cancer Institute. So I'm not listed on the online, but there is an online practitioner list and it can be found at the New York State website listed below. If you do a quick Google search for New York State medical cannabis or medical marijuana, you can find this very, very quickly and easily, and you can sort it by county so you can see who's nearby you, which is very helpful. And as of March, for almost 4,000 of us in the program. So then is the why. Why should you get certified for medical cannabis? You can go to a recreational dispensary and get cannabis if you'd like to. It is legal in New York State now, so why should you get a medical card? Well, there are some protections that come with a medical card. So certified patients are protected from discrimination under the New York State human rights law. So this card deems this a protected disability that it cannot be discriminated from by employers. So employers cannot refuse to employ an individual just because they're certified in the medical cannabis program. However, if they came to work impaired, that might be a different story, right? So that is a different story for a different day. Certification information is deemed exempt from public disclosure. It allows patients to have access to a licensed pharmacist to help them with dosing. And it allows for price fixing by the Board of Cannabis Management to maintain affordability. I don't entirely agree with that statement because I feel like the prices have been a little bit high. They are getting better, but it is going to be a good thing to have a medical card versus a recreational as we really get launched into recreational. So these are the qualifying conditions and regulations that were in place, and they were updated from 2015. They were updated a couple of different times. You can see in the bottom left corner, they added PTSD and chronic pain, opioid replacement, and opioid use disorder as the years went on. This is now no longer current. So it is, as Dr. Papone mentioned, the current state of it is that a person is eligible for the use of medical cannabis if it's deemed clinically appropriate by the certifying provider. So I can use my best clinical judgment to say if I think the patient will benefit from medical cannabis or not, which is much more helpful than the old regulations were. So with the old regulations, I could have a patient come to see me and say their appetite was really bad, but they had not lost any significant amount of weight. So it was really hard for me to justify with those really strict rules to give someone a card for that because it didn't qualify as cachexia or wasting and losing lots of weight. So this new kind of rule that allows me to use my medical judgment has been very, very helpful. This is kind of an article that I found from 2019 that just does a survey of national certification conditions. So between 1999 and 2017, chronic pain, as you can see on the graph, is the highest amount of certifications in the country. We have chemotherapy-induced nausea and vomiting. We have some others in there. We have spasticity with multiple sclerosis, PTSD, cancer, and epilepsy. So those are kind of the big certifying conditions around the country over those 20 years or so. For me, in my clinic, in my practice, I generally see patients for decreased appetite, unintentional weight loss, pain, neuropathy, nausea and vomiting, anxiety, insomnia, and muscle spasms. Oftentimes, these symptoms are directly related to their cancer and or their cancer treatment. And it may be that their cancer treatment was 10 years ago and they still have neuropathy. That's fine. It's still something we need to be helping with. And a lot of these things are really challenging to treat. So neuropathy, for example, as well as appetite loss are very, very challenging. And there's not a lot of good medications out there that don't have significant side effects or can be used in the long term, like steroids. These are the most common things I see patients for in my day-to-day practice. All right, so next up is what? So New York State allows sublingual products like tinctures, suspensions, lozenges, effervescent tablets, oral sprays, consumable products or edibles like capsules, tablets, gummies, oral powders that can be mixed in liquid, products for inhalation like cannabis flower and the vape cartridges that we talked about earlier. There have been approval for suppositories. They were on the market for a while. I've not really seen them much, but I'll let Stacy talk more about that. Topical lotions, ointments, and balms have become a lot more popular with patients in the last couple of years. And now patients are also allowed to grow their own medical cannabis at home. Every dispensary can be a little bit different. So just because something's available at one doesn't mean it's available at another. But all of the dispensaries have a great variety of options and doses and formulations. In regards to dosing, there are no guidelines for medical cannabis dosing. So a lot of times it's a little bit of trial and error to find the right dosing. So we may have to start out with one dose, work our way up to the next dose, and try even modifying that further. So we work really closely with patients on a clinical level in clinic, but also Stacy and the folks at the dispensaries really do give so much help for our patients in dosing recommendations. And the doses in New York State are based on a ratio. So 20-1, 1-1, 1-20. It may depend on what symptoms someone has, but it also may depend on their experience with cannabis, what we recommend. So if someone comes to see us and they say they've used cannabis once a week for the last 2 years, that would be a different scenario than someone coming in and saying, I've never tried cannabis in my entire life. So we need to be kind of mindful of their experience. But just to kind of go over what THC and CBD kind of are good for. So we feel like, and I say feel like because we don't have a lot of great evidence, as Dr. Papone talked about earlier, THC is felt to be the best for pain management, nausea, vomiting, appetite stimulation, and sleep, but it is a psychoactive component of cannabis, meaning it's what caused people to feel high. So we want to be very careful to avoid side effects and not start out with too much THC. And then we have the CBD component, which is good for nerve pain, inflammation, seizures, epilepsy, and muscle spasms. So a one-to-one product would be like a balance of both of those and can be really helpful for a lot of different symptoms. But certainly I have patients on all of the different strengths for various reasons. And some people use one strength during the day and another one at night. So it can be very, very fruitful. Some possible physical side effects, I would say in terms of my patients, just anecdotally, I would say the side effects are pretty minimal, but can include dry mouth, fatigue, feeling sleepy, loss of balance, fast heart rate, low blood pressure with associated potential lightheadedness, short-term memory loss, reduced attention span, motor control. We definitely talk about not driving on medical cannabis. And in very rare circumstances, patients can have hallucinations, paranoia, and euphoria. And sometimes when I've seen this happen, it's because we mixed two medicines we weren't supposed to. So like someone forgot and took their oxycodone after they took their medical cannabis, and it kind of was a little bit too much. So where would you go? So Stacy will give you a little bit more info on where to go, but this is just a map of the dispensaries that are in New York State, the medical dispensaries. You can see our area is pretty, we have the two here in Rochester, so we're very lucky. I serve patients all around the Wilmot catchment area, which goes all the way over to like Syracuse, Ithaca, and down into the southern tier into Olean, Hornell, Dansville, and so forth. And all of those patients have to drive a really long ways to get their medicine. So one of the things I'm hoping will come in the next couple of rounds of updates in the program is that we'll be able to improve access for people because a lot of our rural patients don't have great access right now, and that's a shame. And how? So how do you get certified? Talk to your healthcare provider. So you can talk to your primary care doctor, you can talk to your oncologist, your pain management specialist, neurologists, palliative care specialists. A lot of people in these specialties can anybody in any specialty can certify for medical cannabis, but these specific specialties oftentimes do have certification providers within their specialty. So at Wilmot, I am a provider in oncology that is kind of a person that's designated to do that. But we also have our palliative care team, and they are all able to certify patients and manage medical cannabis with them as well. The most important thing is that I think physicians, nurse practitioners, PAs, providers in general, who don't certify for medical cannabis don't actually realize how easy it is to get involved in the program. So it's the educational component online, and then working with the pharmacists and the dispensaries to help with the patient's dosing. It actually can be a really easy kind of process to get involved in. So I think a lot of times people think, oh, it's too much paperwork and I don't want to do it. It actually is really not that much. It's pretty simple to get into this program. I also encourage people to do research, certainly use the New York State website and reputable medical websites, not just kind of like Joe Schmo's blog. But the New York State Medical Cannabis website is very good. It has a lot of good resources, PDF files, and of course, a list of practitioners in the areas that may be nearby you. And that's all I have. So I'm going to pass it on to Stacy.
Thank you. That was a lot of great information, Patty. Wow. So we'll turn it over to Stacy.
Okay.
Okay, so I guess we're gonna get this version of it, but okay, so following along with the timeline, which you've heard pieces of already, we'll go through the evolution of the state regulations because it's kind of hard to give an update on where we are today without looking at how things started. We'll talk about home cultivation, which is only allowed for medical use at this point, some of the risks of the illicit market, some of the differences between medical and adult use, some of the safety and testing requirements that the state has, and then, looking ahead at what could be coming up. So starting back in 2014, when the Compassionate Care Act was passed, we became the 23rd state, including the District of Columbia, to legalize medical marijuana. And this was run under the Department of Health at that time. And then if we jump ahead to 2016, January is one of the first medical dispensaries opened in New York. That's when I started, January 2016, I started here at Columbia Care. So it's been a very interesting 7 years. This is my 8th year now. A lot of things have evolved in the program during that time. But as you saw, there are only 10 qualifying conditions at the beginning, only 5 registered organizations, which could have up to 4 dispensaries each. So only 20 dispensaries were allowed in the entire state. It was very difficult to find a provider. You had to wait for the actual physical card to come in the mail before you could purchase medicine. The dosage forms were a lot more limited. There was no flower of any kind allowed at the beginning. The possession was limit was a 30-day supply. And everything was vertically integrated, meaning a company had to grow their product, process it, package it, and sell it. So there was no wholesaling. So between these 20 dispensaries, you had to go from one to the next if you wanted to try a different company's product, a different ratio, a different dosage form, anything like that. And there was no home delivery at the very beginning either. So now in 2021, just about a couple of years ago now, is when the Marijuana Regulation and Taxation Act was signed into law. So MRTA legalized adult use and also expanded the medical program and established the Office of Cannabis Management, or the OCM, and the Cannabis Control Board, which oversees the OCM. So they consolidated the medical and hemp programs, which were under the Department of Health, and added in adult use, and now all of that is controlled by the OCM. So they have also addressed issues as part of MRTA of social equity, allowing record expungement for minor cannabis records, issuing card licenses, which were the conditional adult use recreational dispensary licenses, and then stating that 50% of the dispensary licenses should be social equity licenses, which means minority owned, women owned, distressed farmers, service disabled veterans, things like that. They also addressed environmental sustainability, having certain packaging requirements, or that they need to be made of a certain component of recycled materials or can be recycled, and established a tax revenue fund where a certain percentage would go to education, to drug treatment, and then to community grant reinvestment as well. So some of the changes to the medical program that MRTA allowed was additional practitioners, as you've already heard, expanding the qualifying conditions, including basically getting rid of having to fall into one of those categories, increasing the number of dispensaries allowed from 4 to 8. While this would increase access, there's also some rules to that. Dispensaries number 5 and 6 need to be in an underserved geographic location or unserved, and the state hasn't really defined what they mean by that yet. So you're not going to see another dispensary popping up anytime soon until they can spell out what they mean by that. And then once those 2 are up and running and operational, then they would consider the last 2. So there's going to be some delays with that, but hopefully progress at some point. MRTA also allowed for the sale of whole flower and allowed smoking as a dosage form versus just ground flower, which they had allowed before, and vaping of flower. So you can vape flower or you can smoke the flower. And then they increased the possession limit from a 30-day to a 60-day supply. MRTA also allows for a new type of license too for cannabis research purposes. So a researcher can actually grow and process their own material too for research purposes. So now in October of 2022 is when the home cultivation became active for medical use only. Eventually it will be for adult use. So only registered patients and caregivers 21 and older can participate. You can grow it at a private residence, whether you rent or own, just not on federally funded property. Obviously, you need to know if you're a renter, if a landlord restricts smoking on the property, they could restrict smoking of something like this, but not necessarily growing. You can have, and you can see in the graphic, this is from New York State, if you have one person in the home, you can have 3 mature and 3 immature plants. So mature plant just means you can see the presence of buds. So you can have 3 of each for a total of 6. But if there's 2 or more certified patients in a home, or if you're a caregiver for any patients, the total is 12 plants per household, 6 and 6. But once the flower is processed, you can have up to 5 pounds of processed plant material at home, and they consider processed after it's been trimmed. So a caregiver grower, they can't charge you for growing for you, but they can ask to be reimbursed for their expenses. So if you have a caregiver to grow for you, soil or, lighting costs or, travel expenses or anything like that, they can ask to be reimbursed, but they can't charge you for the service of growing for you. Another thing that's really interesting under this is that a registered patient can transfer to another patient or caregiver the plants themselves or plant material. So the normal possession limits for adult use are up to 3 ounces of flower or 24 grams of concentrate. So if someone has plants or material at their home, they can transfer that to another patient or caregiver. Obviously, they can't sell it, but they can give it to them, which is different from the rest of the medical program. So anything that comes from a dispensary is labeled for a specific patient with a label with a doctor's name, the patient's name, the caregiver's name, dosing directions, all of that. But you can't transfer that to another registered patient. That's tested by the state and everything, but you can't transfer it. It's only allowed to be used by that patient. Whereas this is a little different now that you're talking about plants and plant material that's grown at home that you can transfer between patients. So also in 2022, not just that year, but there has been illegal recreational, sales that have been a big issue. A number of locations have been sent cease and desist letters by the state or warnings that, we know what you're doing, we know what you're up to. And if you try to get an actual dispensary license in the future, you could be blocked from that. But a lot of these places don't care. It's really just a cash grab. There's so many popping up, it's hard to control. New York State has been criticized for it. There's been a number of lawsuits, specifically in New York City, directed at the locations, some at the landlords of these illicit operations, allowing them to take place on their property. And then just last month, over 400 different shops were sent letters of eviction for selling without a license. So it's a big issue. Nationally, it's not just local, it's not just in New York, but legal dispensaries are restructuring, conducting layoffs, business acquisitions, price reductions. It's affecting the entire country. Price reductions you think would be good because of competition, but it's not necessarily a safe market to be purchasing medicine in. So there was a report released last November of a joint group of cannabis associations in New York, Connecticut, and New Jersey, who went around in New York City to 20 different illicit dispensaries, bought minimum of 2 products from each location, and found that they were selling a lot of tainted and mislabeled products. 40% of the products that they took and physically handed over to the New York approved labs, they failed at least one of the standard tests that our labs do on regulated product. They found heavy metals, lead, nickel, they found pesticides, they found E. coli and salmonella. And these were from all sorts of products, flour, vapes, candy, gummies, tinctures. They had a variety and found a lot of contaminants. They found that the dosing was not consistent. Often they were tested 50%, or half of the potency that they were labeled to be. And in some cases up to 100% more. Like they even had one that was labeled, it was like a gummy or a candy or something, labeled as 100 milligrams in a single piece, and it tested at 200 milligrams. So the consistency is not there at all. So even if you're not using it for medicinal purposes, it's not necessarily safe either. Same thing with packaging and labeling. They used cartoon characters, kid-friendly snacks, obviously copyrighted images, things like that they were marketing. And another safety issue there, it's a public health issue that these things need to be kept away from pets, kept away from children, and not marketed, to them. Also, when they went in, they would ask like 3 questions of each dispensary, like, oh, is this legal? Oh, is it tested? And things like that. And another thing that they found is over half of the locations didn't even request ID when they went in. But throughout 2022, there was a big push that they said that they were going to get the first legal adult use dispensary opened in New York State, and they just made it under the wire on December 29th. The first one opened. So in this February, about a month ago now, is when the updated medical program regulations were adopted. So this removed the per serving dosage limit, which was 10 milligrams per serving. So in a single vape inhalation, in a single tablet, in a single dose of tincture, in a single gummy, in a single scoop of powder, there couldn't be more than 10 milligrams of THC. Now they don't have a set dosage limit now. I know that there are 25 milligram per dose products out there at the moment, but it's not like there's no limit, it's just what they will approve. And then again, the caregiver, you can be a caregiver for up to 4 patients, or one patient can have up to 5 caregivers. Only one caregiver can be a grower. So you can only have one grower for you if you're not growing for yourself. You can't have both. But that does not include facility caregivers. So a facility caregiver is another category where a hospital, a day program, a school, a nursing home, assisted living facility, they could be a facility caregiver and register with the state, and they can keep the medication safe for the patient, administer it, possess it, pick it up for them, things like that. And then, as we've already heard, starting this week, it was a little bumpy, but I think overall definitely helpful for patients. The new ID process, where the registration is done at the time of certification. Patients don't have to log on to the website and get a card and say that their driver's license still looks like them and all these things. They don't need a card at all anymore. So to make a purchase, all they need is that certification form and a government issued photo ID. So that barcode on the certification form, they can show their certification on their phone. They don't even have to have a paper copy of it. But they have to have their photo ID with them. So looking at the medical program where we are now, as far as what's allowed versus the adult use program. So the medical program currently has 38 locations of the potential 40 that it could have open. Adult use now has 5 locations. One just opened last week even. 3 downstate, 1 in Ithaca and 1 in Albany now. The dosage limits for the medical program is a 60-day supply. For the adult use program, the dosage limits are 10 milligrams still per serving. There's also a limit of like 100 milligrams per package. They both have similar dosage forms and, ingredients. Adult use can use food grade ingredients. Medical program has to use pharma grade ingredients. There's more dosage forms allowed in the medical program, like the suppositories that Patty had mentioned. We used to make those in 3 different ratios: a high THC, an equal, and a high CBD. As a dosage form, suppositories are great for absorption. They don't have first pass metabolism. They work really well, but not a lot of people's go-to. So they weren't really popular, and those kind of faded with the push for all these other things. The taxes in the part of the medical program, the taxes, the excise tax is covered by the registered organization, but the adult use program, there will be a minimum of a 13% excise tax because it's a local and a state tax. And then there's also another point that it's taxed from the distributor to a dispensary based on the percentage of THC in a product. So if a place is a micro business and they're vertically integrated, then those taxes will add up at the end and be on the customer. There is no age limit for the medical program. Anyone 18 and under or incapable of consent has to have a caregiver that is 21 or older, but otherwise there's no age limit. Adult use, obviously 21 and older. The medical program does allow for home grow already. Adult use home grow is not allowed yet. The regulations need to be spelled out for that. It's in there 18 months after the first dispensary is open. So it could be sooner, but it can't be any later than that. Home delivery is allowed for adult use and the medical program. As Patty had mentioned, you know, with the dispensaries being so spaced out, not all of the locations throughout New York State offer home delivery. I mean, some do, even some in New York City, you know, will do same day delivery. But we have home delivery to 13 counties in upstate New York, from Buffalo to Syracuse and down through Steuben County, right to the PA border. So our drivers are busy, but there's still a demand for more access, definitely. And then for the medical program, there is potential insurance coverage for your certification appointments, whereas adult use is all out of pocket. And even in the medical program, there is no insurance that covers this. It's out of pocket, but a lot of dispensaries offer discounts for first-time patients or veterans, seniors, Medicare, Medicaid, Social Security, disability, things like that. As far as insurance coverage, what the state has said is that if a provider sees you only to be certified for medical cannabis, it doesn't have to be covered. But if they see you for other things, and one of the things that they do is certify you for medical cannabis, that can be covered. So that's why a lot of providers are still cash only, because it's not something that's often covered by insurance, you know, depending on their practice. Telemedicine has become really popular too for this, where you go online, you spend your $100 to $200, you talk to a doctor, you know, through the computer for 10 minutes, and you get your email certification the same day. So sometimes this is nice because it's really convenient and improves access, but you could be talking to a doctor in Florida or California who just happens to be licensed to practice in New York State, but they're never here and may not be as aware of what's available or the rules and regulations. So some of the safety and testing requirements that the state has for both medical and adult use, they're pretty similar. They have to be tested by state-approved labs. They're checked for potency, contaminants, pesticides, heavy metals. They have to have certain packaging. They have to have warning statements. They have to have a barcode or QR code that links to a COA or certification of authenticity, basically to show you those lab results. They're not supposed to be attractive to individuals under 21, using like big bubble fonts, neon colors, or cartoon images. All that's prohibited across both programs. The product limitations: they can't have synthetic or artificially derived cannabinoids. They can't contain basically sources of alcohol. They can't be shaped like anything fun, animals, people, fruit, things like that. So how do you tell if a location is an approved facility? New York State has online a list of both licensed medical dispensaries and licensed adult use dispensaries. And they're also required to have, just recently, this sign here, the turquoise one with a QR code. So that has to be displayed in the window, and you can scan that QR code to see if that place is a legit location. The sign on the left, the THC in the triangle, 21 and up, and the New York State logo, that's something that has to be on all of the adult use products. The medical doesn't have to have that necessarily. This is for adult use. And then New York State has also done some advertising and sort of PSA bulletins. You might see them on buses or billboards, you know, saying to, you know, use cannabis carefully, or, you know, you're out of your mind if you drive while high, things like that from the Department of Transportation. So just like you'll see them for, you know, click it or ticket, or drive sober or get pulled over, or, you know, don't drive sleepy, you know, now you'll start seeing a lot more of these for cannabis as well. And then looking ahead, so the adult use program has had a number of delays so far. They haven't raised the funding that they said they would to support these card licenses. They've had a couple of lawsuits come up. One questioning the card licenses, the fact that you have to be a resident of New York State and affected by the medical or the cannabis laws in New York State. And there's a person from Michigan who's questioning that. So that's why there's an injunction where the state can't issue adult use licenses in the 5 different territories that this person has applied to, which includes the Finger Lakes area and Western New York. There's also another lawsuit from some of the registered organizations, actually and providers and a couple of potential licensees. That one was just this week too, I think, suing the state to say that they're taking too long, the illicit market is getting too strong, and that needs to be, you know, counteracted by adding more dispensaries and saying that the ROs are more capable to do this on a faster timeline, so we shouldn't have to wait. As far as I'm aware, Columbia Care is not part of that, but it's happened. But New York is projected to be the 2nd largest market in the world, only behind California for just adult use, with an estimated $5 to $7 billion annually. But as you've heard, there is more data, more research is needed, looking at THC and minor cannabinoids, the terpenes, the idea of this entourage effect, you know, how they work together, which is kind of the opposite of how medicine works. Even medicine from natural sources, whether it's, you know, Taxol from the bark of the yew tree, or, you know, digoxin or digitoxin from flower for heart medication, or diabetic medications from the saliva of the Gila monster. Usually the medical approach is to isolate a single compound, find out which one of those compounds has this effect, go for that one compound and, you know, reproduce it in a lab. And cannabis doesn't seem to work like that. The THC and CBD work better when they're together. And then how do these minor cannabinoids and terpenes play a part in it? That's when you're looking at, you know, the whole flower, whole plant material, some people do better on. Even looking at like a plant-derived tablet, you know, of like a 1-to-1 ratio versus Marinol, which is just synthetic THC. You know, you can have someone who can tolerate a higher level of THC by adding CBD to it, so that they reach the level that helps with their symptoms, but they can get, you know, more of the medicinal, less of the recreational side of the THC by adding CBD. And CBD also has a number of its own medicinal effects, so you could benefit from that as well. Currently, there is only one cannabis-derived FDA-approved medication. It's Epidiolex from 2018. This is a CBD-based medication approved for a couple of very rare forms of intractable epilepsy for pediatric patients. And then even more specifically for CBD, looking at the safety, efficacy, and dosing of that. So CBD was legalized under hemp-derived CBD, legalized under the Farm Bill of 2018. And people have been saying, oh no, it's safe, it's natural, just market it and as a supplement and put it on the shelf with everything else so people can have access to it. It doesn't get you high. So the FDA did look at that, but they said, because we don't know the safety limits or the efficacy, because it's used for so many different things, it can't be regulated as a supplement. So they're trying to find another way to actually regulate hemp-derived CBD, or basically CBD that are plant material that has less than 0.3% of THC by weight. And then looking at federal legalization versus just rescheduling it, like Patty mentioned, from a Schedule I controlled substance to something else. Right now, there are 39 states and District of Columbia that have cannabis approved in medical in some form, and 21 states that have it approved for adult use. And this has only grown over time. So if you did make it legal on a federal basis, that would affect interstate commerce. It would affect perhaps the gun laws, because on that form that you have to fill out in order to purchase a gun, you have to check a box that says whether or not you use or are addicted to controlled substances, and they consider cannabis to be one. And there's even a little statement to say, it doesn't matter what your state says is legal, this is still federally illegal. So even if it's medically approved by a provider, it still doesn't count. And also, if it was rescheduled, that would certainly open up the doors for research and make it a lot easier to get a hold of, whether in New York or anywhere else. So there we go. Any questions?
Thank you very much, Stacy. That was really, really great. So much information from all three of you tonight. I do appreciate it. And the answer is yes, many questions. So I will just get started. The two that came in prior to the seminar starting tonight included one about Rick Simpson oil, which I just learned a new phrase. Stacy, do you feel like there's anything that you needed to talk about with that?
So Rick Simpson oil, or RSO oil, is basically just a cannabis extract that is a high THC form that isn't processed a lot. Basically, it's whole plant material. So you're getting the benefit of the entourage effect more with it. It's used orally, it's used topically. There are a number of claims about it. I don't know that they're necessarily all valid, but it certainly is something that a lot of people do use. It is very common. So I know from our case, I know we have a concentrated cannabis oil, but it is winterized. And so it doesn't have the terpenes in it. It's just the distillate oil. So it's concentrated. It's the most concentrated product we offer. It comes in like a little oral syringe. So it's very potent, but New York State did not approve that for oral use. They only approved it for vaporization. So it was made to be used like that, and the same formula is used in other states, orally, topically, whatever. But New York State didn't approve it for that. So we're not the only ones that make a concentrated oil. Other ROs do. But strictly speaking, there isn't an RSO oil available in New York State from the medical program. You know, a lot of that, it would be homemade, basically, at this point.
Okay. And Dr. Papone, we talked briefly about this question, the current status on data out of Israel regarding cannabis and slowing progression of breast cancer.
Yeah, so there's been a number of studies out of Israel. They're one of the world leaders in cannabis research. They've had a number of studies showing that cannabis has the ability to inhibit breast cancer growth, stop breast cancer growth, stop the spread of it. but those are mostly cellular and animal trials. To date, there haven't been any human trials yet conducted, and no evidence yet. But it doesn't mean that we won't have some trials coming up, hopefully human trials in the future, to translate these cellular and animal studies into humans.
Okay. All right, so I'm just going to start with the questions in the chat, and whoever of you feel as though you've got an answer, please feel free to jump in. Can either of you discuss the possible anti-neoplastic effects of cannabis?
I mean, yeah, so I just touched on that a little bit. Cannabis does, in lab and animal studies, show some promise in stopping the growth of cancer cells, stopping the recruitment of new blood vessels that cause the spread of cancer, and also increase cell death amongst cancer cells. So all good things. But as I mentioned, these are studies that take place in just cellular models on dishes and also animals. So it's important to remember that we have many, many animal studies that show a lot of promise that ultimately don't translate. So we have some great initial promise. That's great. I think cannabis holds a lot of promise for what me and Patty have been talking about in terms of cancer side effects a little bit more. But hopefully down the road, we'll see how cannabis works with some of our modern therapeutics.
Okay. There's a question about certification. Do you need to get recertified? If so, at what time interval?
So yeah, certification is generally can be valid for up to 1 year. There used to be a box that I could check if somebody was on hospice, or that would make it kind of an indefinite certificate, but they've removed that since. The certificates are renewed annually at the most. So
Okay.
good question.
So someone wrote in and asked, when did the regulation on symptoms change? I had a conversation with my oncology nurse practitioner last month, and they still had the rigid symptoms, and indicated anxiety wasn't viable for this.
So I think that changed last year. It's not been very long that I've been seeing patients for anxiety. Certainly it's been one of those ones I'm very grateful that they changed the rules about that, and the cachexia rule. But yeah, that is definitely something that if the provider feels the patient could benefit, that anxiety is under that umbrella now.
Okay. A question about the plant growing. If this person and their wife lived in different residences, so he's the caregiver, she's the wife, could they each have plants? Yes.
Yeah,
Okay.
so
Yeah.
if you have different residences, basically it's per household. So, I mean, you can only have up to 6 plants per person, but if you had 2 residences, I mean, you could, if you live together and you're both patients, you could both have it, but you can't like have 6 in one house and 6 in another house. So it's only per person. Like you can't have a caregiver growing for you and you're growing yourself.
Okay.
So
I do think that was a question.
yeah, so who's gonna verify that? I don't know, honestly. But the other thing is, you know, where do you get this stuff? So it's legal, now what? You can, the registered organizations that are working now are allowed to sell clones and allowed to sell seeds. I don't believe any of them are. Seeds are technically not illegal because they contain below 3% of THC per weight. And there are a number of legitimate seed banks around the country that you could technically order from.
Right.
That's interesting because it says on the New York State site that you can purchase seeds from a registered organization.
You can if
But they
sell
don't want you to, do they?
you can if they sell them, but I mean,
Sell them.
yeah, I would maybe be interested in seeds. I'm not someone with a green thumb like myself. So I have all these pretty packaged neat things in my vault, and the idea of having clones in there, plants that need light cycles and watering and nutrients and all of this attention is not what I do.
Yeah.
So I understand like it would be beneficial to be able to get something like that, but Like you were mentioning, New York State does have kind of a really quick how-to, to say like,
Mhm.
this is how long the growing cycle is. This is how long it takes to germinate. This is what your trichomes look like when they're ready to harvest, things like that are kind of
Yep.
good starters.
Mhm.
But yeah, I'm sure a lot of locations around could assist you with things like that.
Oh, yeah.
But yeah, you can buy them from the ROs, just none of them sell that.
I believe that any of the Indian territories have seeds and would sell them to you also locally.
And I would suggest getting feminized seeds already,
Yes. Mhm.
because otherwise you're going to have to grow them, wait weeks to see which ones are male, which ones are female. Obviously, the females are the only ones you want. Of course, the ladies do all the work. We call the plants that we take all the clones from, they're called the moms, the mothers.
Yep.
So, you want to go for feminized seeds so you know what you're going to get and you don't have to weed them out.
Yeah, folks, growing is not an easy task. It's not like growing tomatoes. It's pretty hard. And Stacy gave a great word of advice. Always just buy seeds that are guaranteed to be feminine. Because I've heard stories, like if you have one male, it will ruin everything that you have within the whole room. So it's not even worth messing. New York State has their handy little guide and it shows you how to identify male versus female. Let me tell you guys, this is not easy. Not easy at all. They got this like little half-page thing on it. Man, you could show me it's like when doctors show you the x-rays and they go, oh yeah, here, and here. And you're going, what? Very tough to do, but quite possible for someone that is a good grower.
Interesting. So next question, can medical marijuana be used after the expiration date on the package?
I can't recommend that you use it after the expiration date on the package. So it is tested to a certain date so that it still has a potency within a specific range. Does it go bad necessarily? It depends. If it's been exposed to things like heat, light, humidity that can degrade the active ingredients, you can have conversion of some compounds to other compounds. So the effect might not be the same that you're looking for. And obviously if it's plant material, it could get dry, it could get moldy, who knows? So I can't recommend that you use it past that date, but I can't recommend that you use cough medicine past the date on the package either.
100%.
Got it. So this next question, if you grow it at home, are you still able to buy at the dispensary or do you need to decide between the two options and only use one method?
Yeah, no, you can do both.
Oh, wow.
Yep. And you
Okay.
can have a tincture from the dispensary and flower from the dispensary and a vape from the dispensary and have your own plants at home.
Okay. If you travel with a medical certificate, are you able to have your meds with you? What restrictions might there be?
No, so that's a federal law. You're not allowed to
Right.
take cannabis across state lines. I'm actually surprised none of us said that. Because we all were pretty thorough in what we covered. But yeah, so I have a couple patients that are snowbirds. They don't take their medicine with them. They go to Florida for the winter. They come back, and when they get back in April or May, they start going back to the dispensary when they get home. So yeah, they can't take it with them. In New York State, yes, you can, but outside of New York State, you cannot.
Great.
Yeah, some states do allow reciprocity with New York. Like if you show your card in another state, you can purchase there. New York doesn't have reciprocity. Like you can't use a card from another state here to purchase. There's residency requirements. But there are also, dispensaries galore in Florida. We have a number of snowbirds who will get registered here and registered there. So they purchase product there and they purchase product here. They just don't bring it back and forth.
Yep.
Wow.
Yeah, like Stacy said, also a number of states do take other states. New York is not one of them, but I think like Arizona or Nevada, they might take other. I think they take other states.
And some of the other states will not like accept the card per se, but they'll give the patient a discount if they go to a recreational. So I had a patient in Las Vegas who went to a recreational facility, gave her medical card for New York, and they gave her 20% off. So she was able to get medicine while she was in Las Vegas for a trip and used it while she was there and then didn't leave with it and came home and was all set.
Yep.
Interesting. All right. And then a question here. I'm an oncology nurse in Ithaca. Many of our patients are deterred with having to travel a distance, 45 to an hour, to get to a dispensary. Once a patient is certified, are there options, something like telehealth or a phone call to the dispensary and then home delivery? Or does the patient have to travel to the dispensary for at least the first visit? And do all medical dispensaries have a reputable pharmacist?
So yeah, as far as a pharmacist, just like any provider that's participating with the program, any pharmacist at a registered organization also has to go through the same online training. Mine was the 4 hours too, which wasn't, I mean, it's not that extensive either, just because the data is so limited. But you know, you go with what you got. A lot of it's been on the job training, certainly. But we go through the same training as any provider does. You know, we're regular registered pharmacists like you'd see at CVS or, you know, Walgreens. I worked in pharmacy, this will be 15 years, and I worked in a regular pharmacy, and I've worked here now, this will be 8 years. So yeah, there's a pharmacist on duty every minute that a dispensary is open. You can always call with any questions that you have to a dispensary and talk to a pharmacist. You don't have to visit the dispensary the first time. If you have a place that delivers to your location, at least for us, you don't have to visit here. You can talk to someone on the phone. You can look online at our menu online, figure out what you wanted to purchase and go right to home delivery without ever stepping foot in here. Yeah.
Oh, wow. That's great to know. This next person has a question, and to know what you recommend. They plan to do their winter in Florida. So would you recommend that they could keep their product here in New York and it would still be okay for them when they come back? Or should they plan to time things so they use it before they relocate?
I would say that, so I know for a fact the federal government keeps their marijuana in the freezer as long as it's airtight. So if you want to wrap it up airtight, keep it in your freezer, it should be good. But I'll let Stacy also answer that. I know that's good for long-term storage because they would retest it when they got it out a couple years after the freezer and it was still good. But it has to be airtight. That's the one key.
Yeah, so I guess it depends on what type of product you're talking about. You know, if it's a vape or a tablet or something like that, you know, if it's unopened, it should be good until the date on the package. Flour would probably be tougher to leave, you know, for months at a time. You'd want to leave it, anything you'd want to leave someplace away from like heat, light, humidity, all of that. Somewhere safe where no pets are going to get at it or anybody, you know, who's taking care of your house, you know, you'd want to keep it secure. What we recommend, because there are Columbia Care dispensaries throughout Florida as well, is that a lot of the formulations are the same too. So you don't have to worry about traveling with the exact same product. You know, you can get the way they formulate their vapes down there is the way we formulate our vapes. So it's very similar that way. You know, everything isn't exact because states have different rules, but yeah, it depends on what product you're talking about as far as whether I try to time it for what you keep, because it can get expensive. Yeah.
Sure. That is all the questions that have come in. This has just been fascinating. I thought I knew some things before we headed in here, but I've learned a lot tonight. So I'm sure everybody in the audience has as well. A big thank you to our panelists. Each of you were just, you know, a wealth of knowledge and clearly very passionate about what you do. Just amazing. And I have to close with one question for Luke. And what is that plant behind you?
I think that's a money tree. I believe this is a
Which
money
looks
tree.
deceivingly similar.
Well, we like grants here at the U of R, and this is what brings in the grant money. Okay. So yeah,
Love it.
it's but keep an eye out for our upcoming studies. I'm going to use my little plug. We're going to hopefully be opening studies for any cancer patients that are on chemotherapy, and breast cancer fits that. Okay, so any moderate or highly emotogenic chemo, which is quite a few of them, we're going to be opening that up and seeing how it works for nausea and appetite. So I wanted to give that little plug. So
feel free to share that with us at the coalition, and we can absolutely spread the word.
Most definitely would love any help we can get.
Wonderful. Just a reminder to fill out the survey as you're exiting tonight. Thank you so much. I'm glad my kids just came home. Thank you so much for taking part in this tonight. Have a great night. Thank you, everyone.
Thanks, everybody.
Thank
Appreciate
you.
all the comments. Good night, everyone.
Night.
Night.